If I have the privilege of seeing you in my office, or at first even by Zoom, and then after a several-hour discussion, you're coming down to the Tampa area and visiting me in my office, we will have a very comprehensive review of what I've been explaining in terms of what the causes of your problem are. But most interestingly, what is the solution? So remember, the problem is that the C1, C2 ligaments are damaged, causing them to slip. Well, what do we do to fix that? Now, some surgeons, when there are problems at C1, C2, or even the rest of the spine, they go ahead and they put in screws and rods, demonstrated, for example, on this model, and they put screws in all of the levels and rods, and some surgeons, many surgeons, actually put a plate on the cervical skull, on the occipital bone, the base of the skull, and they link it to the spine. So there's no further movement. The theory is, well, that'll eliminate the slip, but what is the price you pay? The price is that you can't move your neck, and you will end up in chronic pain and have the opposite result of what you had intended. So we do an entirely different operation. What we focus on is simply stopping the lateral sideways slip of C1 and C2. We never fuse the skull. We want you to be able to bend your neck and rotate your neck. We never fuse the rest of the spine unless in certain circumstances there are other injuries that we can take care of at the same time. So therefore you can bend your neck. And as a result of our surgery, you will actually feel, although there's less rotation of C1 on C2, as I'll explain in a minute, you'll feel that you can move your neck more, because right now you barely move it because of the severe pain you're in. So what do we do? What we do is very sort of a basic concept. We want to just stop the rotation and slippage of C1 on C2. So we take two screws that, and these are the actual screws, that are about 1.5 inches long, and they're 4 millimeters wide, say about 1/5 of an inch wide. And using a special guidance system, we do an operation. And this is the basic operation. You would come in to our surgery center, or in certain circumstances, if you have medical problems or elderly, you would come into the hospital that we work in the Tampa area. We would see you in the morning, of course, and take you to the operating room and put you to sleep, as is normal for any operation. And then we would put a little clamp on your head that's only there when you're asleep, so you don't feel it. It's taken off before you wake up. And then we turn you over on the operating table so that you're face down. And we bring in two guidance devices called C-arms that allow us to navigate and exactly, precisely place the screws that we need to place in C1 and C2 so they don't slip, but do not restrict the rest of movement of your neck or of your skull. So we make a cut, an incision that's relatively small behind the hairline. A little bit of hair sometimes is taken off, but nothing noticeable. And the incision is basically this long. And we move the muscles out of the way. And the first thing we do is we put a clamp on here, and we show that C1 and C2 are incredibly loose. Then we put a monitor, it's a pulse monitor, on the vertebral arteries. Remember, the vertebral arteries are running right here. So we put a pulse monitor on them, and we hear it. Whoosh, whoosh, whoosh. And then we wiggle C1 and C2, and it's cut off when we're wiggling it. So we're simulating what happens in real life that's causing your symptoms. Well, we want to stop that. So what do? We use those guidance devices to place these two screws very precisely from C2 to C1, only in the bone across the joint. And essentially, at that moment, we've solved your problem. However, when you put metal in the body anywhere, it will loosen unless you connect the bones with what's called a fusion. So we take from a bone bank special cells called stem cells that lead to bone growth, and we place them in a containment device over C1 and C2. And over a period of 3, 6, 9 months, these heal and become one bone. So the screws are there really as a scaffold, a temporary placement holder, but we leave them in. There's no reason to remove them. Now we do one other thing. Remember, there's pressure on the back of the brain and brainstem due to the whiplash injury, involving other structures around the brainstem. Well, what we want to do is give you more room. So what we do is an operation, as part of the same operation, where we simply take off about 3/4 of an inch by 1.5 inches of the lower part of the bone. So that exposes and loosens up the brainstem. So the bone normally was here, and instead we remove the bone here, and it gives it more room. It does not impart any risk of instability or damage to the brain because there's so much muscle in the back right at that level. And that's basically the operation. We then inject a long-acting anesthetic in the muscle and then close the skin and the muscles. We put glue on and an antibiotic bandage and a collar. We turn you over after a few hours in surgery, remove the head clamp, and wake you up very quickly. Within 10 minutes, you're awake and even talking. Then we watch you in the recovery room, and if it's decided that you had this operation as an outpatient, we set you up in a suite hotel that we have taken care of, and we also have a trained special registered nurse, RN, who we have trained, who stays with you all night along with your partner, family member, spouse, friend, and monitors you. It's as if you have a private ICU all night long. We live 10 minutes away. If there's ever a problem, which there has never been, we would come see you or take you to a hospital, which we have never had to do. Or if you're in the hospital, we've never had to come in the middle of the night because we have not had any major complications in this operation that we've done several hundred times. And you wear this hard collar. You then stay in the Tampa area for a few weeks. We take your sutures out after a couple weeks. And then we want you to wear the hard collar even when you're home for 6 weeks. And then we take some x-rays, see you again at 6 weeks. And if it shows everything is fine, which it always does, we will put you in a softer collar for 6 more weeks. And over a period of time, this will heal. You gradually increase your activities. You are not bedridden. You do not need nursing care. You do not need to be fed. You do not need intravenous pain medicine. You're given enough pain medicine for a couple of weeks that you take by pills, and you will not be addicted. It's not like low back surgery where you have chronic pain forever. That doesn't happen. And within a period of days or weeks, your headaches are gone. You begin to focus. You can think. Your neck pain is resolved. Within days, we want you up. We want you to become more active. And within weeks, you can go back to your normal activities. And this is the most gratifying operation I have done in my decades of neurosurgery because it is so successful and returns people who want to live a normal life back to their normal life.